All right, so we just started the webinar. Looks like it's broadcasting to all attendees, it says in the corner of my screen. So hopefully you all can see and hear us. Welcome to our webinar today. Today we're going to talk about a lot of different benefit programs that people could make use of during this time while they're either waiting for their unemployment to come through or they're just struggling in other ways. So that is what we're here for today, and I appreciate you all joining us. I am Mariah. I work at Maine Equal Justice, and we're going to talk a little bit more about Maine Equal Justice in a minute, but first I just want myself and my friends here to be able to introduce ourselves. And then also, we're not going to take time for everybody to be able to say hi because there's so many people on this webinar today. But if you take a minute and just type your name and your town and your pronouns into the chat box, we'd really love to see who's here and how far away you guys are coming from. So again, my name is Mariah. I work here at Maine Equal Justice. I'm the Moxie case coach. And what that means is that if you call into Maine Equal Justice with a problem and you need help resolving an issue with the Department of Health and Human Services or other issues, I'm one of the people that you're going to get to talk to. And now I would like my friends to go ahead and introduce themselves. So let's go ahead and do Chris first.
Hi, I'm Chris Hasted. I'm the Senior Policy Advisor at Maine Equal Justice, and I'm so glad to be with you all today.
And then Sue.
Hi, I'm Sue Hamlet. I'm a paralegal here at Maine Equal Justice. I am also someone that if you have questions about various benefit programs, particularly unemployment, you're going to be talking to me.
And I just realized that I asked you guys to share your pronouns and I forgot mine. I've used she, her, hers.
I use she, her, hers.
And she, her, hers.
Thank you.
And my name's Umbreen Rana. I use she and they pronouns, and I'm the community organizer here, so I'm who you'll talk to if you want to get involved with us.
Awesome. All right. Thank you so much, friends. So we are going to dive into this information. There's a lot to talk about today. Sue is here today to monitor the chat messages. And so if you have a question in the moment and you want to ask that question, Sue will be able to get that question and respond to you. And then Chris and I are going to go through the policies and details of the different programs. And then Umbreen is here as our tech guru at the moment, and then she'll talk to you at the end about being able to get involved in our work. Maine Equal Justice is a nonprofit civil legal aid organization. We work on economic justice so that people, low-income people in Maine can have increased economic security, opportunity, and equity. And one of the ways, or some of the ways that we do that is we have direct service, that's Sue and I, who talk to people and help resolve specific issues. Sometimes we do impact litigation. That means that sometimes we may have to sue the state to make something happen. We were suing the state over MaineCare expansion. So that was one of the things that we were working on recently. We do public policy advocacy. So we do, that's what Chris does. We do some lobbying at the State House and working on bills and trying to improve the programs that exist and to expand them to other people. And then community organizing, that's Umbreen. And communications. And so there really is a great full circle of the work that we do here. So we, the direct service kind of tells the public policy, like these are the kinds of issues that we're seeing, and public policy is able to act on those and try to make bills to fix them. And then the community organizing brings people together to share their stories about those issues. So really the way we do work at Maine Equal Justice is unique and really kind of hits all the issues. All right, one of the things I want to make sure you guys know about today is that on our website, we have a COVID-19 resources, and almost everything that we talk about today is going to be there. So if you have questions or you don't remember quite everything, you can look a lot of that stuff up. And then we're also recording this webinar today, and so if you don't remember something and you want to go back, you'll be able to do that. All right, so the first thing we want to do here real quick to get you guys involved in the work is ask a poll question. So Umbreen, can you launch that poll question? All right, so we're asking, are you having trouble making ends meet or facing other crises during this time? And we would really like to hear all the ways that this is impacting people. So if you want to take a minute to do that, check all of these things that apply to you.
if you are a case manager or somebody who's working with other people, you could also respond to this with information about the folks that you're working with.
Absolutely. If you, even if you're not like your job is not a case manager, but you've been volunteering and working with people, we'd love to hear about the types of issues people are seeing. Wow. Looks like we're hitting all of the areas. Wow. All right. We're still getting responses, so I'll just wait a second.
We have a question of putting the poll back up.
Is the poll, can people not see the poll anymore? Oh, I still see it.
I think it's after you vote and submit. but
Okay.
we'll do that after we end the
Yeah,
polling.
so we may not be able to do that, but do keep that in mind for other polls, which we are going to have throughout the
Yeah, throughout the
webinar.
meeting today. So the good news is that we're going to talk about a lot of these things today and ways that these types of needs can be met. And then also, because of the way that we do our work here at Maine Equal Justice, if there aren't ways to meet some of these needs yet, it's really important for us to know about what people are facing so that we can make sure that our advocacy work is going in the right direction, and we're working on helping people meet meet the needs that they really are facing. I really appreciate you all sharing this information with us.
Yeah.
And does anybody, any of my friends here want to say anything else about this? Looks
Wow.
Like huge,
Thank you
right?
so much for sharing this information.
Yeah. Housing and food are the top ones, and that's not a big surprise, but it's also very concerning. And we definitely want to talk more about those issues today. All right. So we're going to go ahead and jump into the information that we're planning on talking about. Let me see. Oh, there we go. All right. Thanks for bearing with us, everyone. We're all getting used to this new technology, and it's not always super smooth, but we're making it happen. So we're going to talk about SNAP, which is food program. We're going to talk about TANF Aspire, which is cash assistance for families, MaineCare, which is healthcare. We're going to talk a little bit about how immigrants can access some of these programs, and then we're going to talk about general assistance. So this is what we're going to cover today. And there is a lot of information. We will try to do our best to be done and leave time at the end for some questions. But if you have a question in the moment, just type it into that chat, and hopefully Sue will be able to get back to you. So we're going to start with SNAP. So SNAP is a food assistance program. What it does is it gives families not cash money, but money that they can use on a card only for food purchases. It can be used at grocery stores, at gas stations, at many, many places, but it can only be used to purchase actual food items, and it can't be used to purchase hot food items, which is sometimes problematic, especially for a homeless community, that they can't purchase hot food. So that's something we always keep in mind and bring up whenever we can. So what goes into food or to the SNAP program when they're trying to figure out whether or not you're eligible? So eligibility is based mostly on income, and all earned income counts, child support counts, Social Security counts. One thing that a lot of families get confused is that they think that if their child has money coming in, like as child support, or the child has Social Security, that the state shouldn't count that towards food stamps. And I agree with that, but unfortunately it does count. So sometimes families think they are eligible when they're not for that reason. And so it's important to make sure you know what counts. One good thing here, though, is that income from work, earned income, has what's called disregards. The state calls a disregard something where they get to ignore part of your income when they figure out your eligibility. So on earned income, there are disregards that apply. And so some people might be eligible at a certain higher income level because their income is earned. Right now, during this time, a lot of income is unearned income. It may be unemployment income that a lot of people are living on. And unfortunately, unemployment income counts at a higher level, and people are less likely to be eligible for food stamps if they're getting unemployment. But it depends on household size. So income, expenses, household size. So expenses are your rent, your mortgage, if you own a home, your insurance, your taxes, utilities, and then for some cases, if someone is disabled in the household, medical expenses can be counted. So there's a number of ways that you can report information to help the department increase your food stamps allotment. So making sure that they have the correct numbers for all these things is really important. There are not asset limits for households with children. An asset limit means that if you have assets, which assets are usually cash money or a second vehicle or property that you own but you don't live on. There's a number of different ways, different assets, and I can't go through the whole list, but if you have something that is available to you that you could turn into cash, that it's considered an asset. Assets don't matter for households with children, but there are no asset limits for households with people who are disabled or elderly, but there are asset limits for individuals who are single adult individuals without children in their household. So the asset limit is $5,000. Chris, I think in this time, one of the most important assets that people are going to have is like retirement accounts. I can't remember, do those count for SNAP?
Some of them do and some of them don't. Most of them don't.
Okay, great.
And they also, yeah, that's right.
Because right now a lot of people who have been working and had some retirement saved up or had an account through their household or through their employer may be needing to apply for SNAP, and so knowing that probably doesn't count is really helpful to make sure that people are applying. If you apply and you get denied, you can always talk to us and we'll see whether or not you were denied correctly, but it's worth applying. You'll never get in trouble for applying.
And you should tell them if you have a retirement account, and they'll figure out what kind it is and whether it counts or not.
Exactly. At the bottom of this slide, there is a link to a food stamp estimator. Pine Tree Legal has this great thing on their website where you can put in your information and it tells you whether or not you're eligible and how much you're eligible for. It's not exactly precise because they're using last year's numbers, but it is pretty accurate, and it'll just tell you whether or not it's worth applying. All right, so really important right now under COVID-19, there's a category of people in Maine who often are not eligible for food stamps. They're called ABODs, able-bodied adults without dependents. And that group of people is usually only eligible for food stamps for 3 months. And then after those 3 months, they either have to be working or volunteering, or they have to have a letter from their doctor saying that they can't work. Otherwise, they're no longer eligible. They can't get any food stamps. Right now, because of COVID-19, because it's so hard to find work right now, that has been suspended. And so ABODs are eligible. So if you were told before that you can't get food stamps because you don't have kids, that's not the case anymore, okay? You will not have to work or volunteer in order to get food stamps. You won't have to get a letter from your doctor, but there is still that asset limit. So think about what you have for assets and whether or not you're eligible that way. Another important change right now under COVID-19 is that households who are already receiving food stamps, SNAP, and needed to recertify, which comes up every 6 months, will not have to do that. If they miss a recertification during this time, they will not lose their benefits, and recertifications have been pushed out a few months. So if you usually recertify in June, you will recertify in July, August, September, because they understand that people aren't able to really get their hands on documentation right now and make photocopies and send that in. And so they've made that exception. The other thing that is really great is that the Department of Health and Human Services was allowed to boost food stamps for households for the months of April and May. And I just found out this morning that also June. So in June, they're also going to be getting it. That's not on the slide yet because I just found out about an hour ago. But for all those months, a household should get the max amount for the household size. So you can see on this chart here, if you're a household of 4, you should have gotten $646 for the months of April, May, and now June. Now the amounts come as 2 separate amounts. You get your normal amount, and then you'll get a separate deposit that's this extra amount to bring you up to the highest. So I've gotten a lot of calls from people thinking they didn't get it, but when we did a little bit of investigation, it just turns out that it came out in 2 separate days. So pay attention to that. If you're a few days past your food stamps normal day and you still haven't gotten the additional funds, please contact us and we'll help you figure that out and get you the funds you're supposed to be eligible for. Another really exciting thing that's gone on with food stamps right now is that all households who have children who usually receive free or reduced lunch are now able to get food stamps for the months that the school has been closed. So most schools closed late March and will remain closed through the end of the school year. And so there will be food stamps that people are able to get. So it was $189 per child that covered both the month of March and April. And then there's going to be $194 per child that are going to cover the month of May and June. So the first one came in May and the next one's going to come in June. One of the reasons this is so exciting is that every child who's eligible for free and reduced lunch can get this benefit. And so that includes people who usually can't get food stamps for various reasons, especially immigrants who are not eligible for food stamps for whatever reason. If their child is getting free and reduced lunch, they're eligible for this benefit. If you're not already getting food stamps, you need to call the Department of Health and Human Services. They will verify with the Department of Education that your child was getting free lunch, and then they will send you a card in the mail and you'll be able to access those food stamps. So food stamps come on what's called an EBT card, and you use that card like you would a credit card or a debit card at the grocery store. So that card has to be mailed to you. And one thing I just want to add here is that those cards are taking a little while to get to people. So the sooner you contact the department about this, the better. And the other thing I want to add is that if you weren't already getting free or reduced lunch, but you are eligible, you contact your school and they will help you apply for that and get certified with the Department of Education. And then you can still get benefits for May and June at this point, even if you weren't getting them before. Am I missing anything there, Chris?
Nope. There's a question that I don't know the answer to, and that is, does it include Head Start preschool children? And if you know the answer to this, Jeanette, you can tell us whether those children were getting free lunch and or breakfast under the child nutrition program. I think they were not, and I think they're not eligible, but we'll double check that and get back to people.
That's a really good question.
Yeah, it's a really good question.
Yeah, absolutely. I had a question from a family who homeschools, and it's my understanding that because they're not registered in school, they won't be able to get that. Is that correct, Chris?
I think that's right. Yeah.
So yeah. If a child wasn't registered already, they'll have a hard time getting this. If a child moved into that area, like right before COVID started, it is still that school's responsibility to educate them. And so they should still be letting people register for school. And if you can register your child for school, you can get this benefit. Okay.
And the only other thing I'll say about that is, and I know this is cutting it close, but if the child is not getting or has not been getting school meals, and if you can get that child certified through your local school district by the end of May, be able to get benefits for May. If you're not, you'll just get June.
Exactly. Yeah. So those benefits are figured out by like how many school days were missed. And so you'll only get the school days for June, which won't be very much at that point. So get on that if possible. All right. So this is the end of the slides on food stamps. I'm going to pause here for a minute. Were there any other questions that came up in chat that we should talk about?
There are some good questions having to do with, for instance, if the town, like in Portland, home delivery of school breakfasts and lunches is happening, is that double dipping? If they're also getting the pandemic EBT, pandemic SNAP, but has this information gone out to the school administration and homeschool coordinators? We don't, I think we can address those questions in a subsequent question answer format, probably.
Yeah, it is not double dipping. I mean, if you are getting help from your local school district now, you're still eligible for this benefit. And
Yeah.
yeah.
And also, as far as whether or not the schools know, this is going through the Department of Education. So yes, the schools are,
Right.
have been informed that this is happening.
That's right.
The schools may make the decision to stop doing those food deliveries. That's up to the school system. I know that mine has decided to continue, but it's not double dipping, and you're not going to be in trouble. Okay. Anything else?
High school seniors are eligible even if they're over 18.
If they're getting school meals, if they've gotten school meals, or if they're eligible for school meals now.
And the question from the Q&A, what age bracket is defined as elderly for SNAP, elderly and disabled?
60 and over is elderly, and a person that is officially disabled, for example, getting SSI or SSD, regardless of age, is disabled.
Great.
Or some other kind of public federal disability benefit.
I know that we went through that quickly. There used to be an asset limit for that category, and it went away very recently. And so some people might think that we are sharing incorrect information there. We're not. It just happened too recently for people to necessarily know about it.
Do you lose your food stamps if you don't use them within a certain period of time?
No, there is a, again, I can't remember the number of months, but you can hold them for a certain number of months. I want to say 12, but I should double check that, and we will post that.
Okay.
I think it's 12, but yes, we should definitely know that exact number. You're right. So we will figure that out.
And we will make sure that people can get these slides to the last questioner.
People
have
register.
to print them. I can't answer the question how to print, but we'll make sure you get them.
Yeah, so everybody had to register for this. So we should have email addresses for all the attendees, which means that we can send out an email with the slides. All right, so we're gonna go ahead and move on because there's just so much information to cover. We're gonna talk about TANF next. So if you don't know, TANF stands for Temporary Assistance for Needy Families, and it is a cash benefit for families with children who are low income. I don't have the numbers in the slideshow today because it's so complicated, but I want to let everybody know that people are now eligible for TANF at higher income levels than they used to be if they have earned income. So if someone's working, the department is able to apply a disregard to their earned income before they start TANF. And if they're eligible after that disregard, then they're eligible. So we should be encouraging families to look into that if they're struggling financially. So TANF rules, there has to be children in the household. Chris made sure I pointed out that if they're still in high school at age up to age 19, they're still considered a child living in the household and still eligible for TANF. Here in TANF, the asset limit is even lower. It's $2,000. The house you live in does not count as an asset. Your car does not count as an asset. Clothes, tools, things that are in your home are not going to count, but if you have a motorcycle or a four-wheeler, those kinds of things do count as assets. And so figuring out whether or not you can qualify is one of those things. The asset limit can be tough for people who who have been employed for quite a while and are now experiencing a difficult time. But we're happy to go over those asset limits with you and see if the things that you have count or don't. Two-parent families can qualify. So it used to be that you could only get TANF if there was only one parent available, but that's not the case anymore. And then there's the income guidelines. I wish I could give you just straight up numbers that say like everybody under this number qualifies, but it's not that simple. And so if someone is struggling financially, have them contact us and we'll help them figure out if they qualify. The TANF household is the parents and all of the children in the household. One important thing here is if there's another adult in the household who's not a parent to those children, so if you have a partner who lives with you but he's not their parent or she's not their parent, their income doesn't count. And so I've known people who haven't applied because they thought that because one person was earning that was going to make them disqualified, and that's not necessarily the case. As long as that parent, or as long as that other adult is not the parent of any of the children in the household, then that other adult can apply for themselves and their children. And then another thing to keep in mind, if you do go on TANF, DHS will go after the other parent. If there's another parent who's not in the household, they will go after that parent for child support. And the Department of Health and Human Services keeps a portion of child support and passes on the rest to the family. So one confusion I run into a lot with people is, I'm on TANF, why do I have to do this Aspire thing? So TANF and Aspire are two different programs that are tied together. TANF is the cash benefit, it's the money that you receive. Aspire is the training and education component that families have to participate in. So if you talk to someone on TANF and they say, I have to do this participation, that's the Aspire program. And TANF is the money that they receive. So after getting, monthly money, what are the other benefits to being on TANF? Well, TANF can give you mileage reimbursement to and from a job or to a volunteer site or other participation. They pay for childcare. It's up to $1,000 a year in car repairs, which is really helpful for families who are struggling. They can pay for textbooks if you decide to go to school, and you can get help with your car insurance and or registration, up to $300 a year. And I think I said up to $1,000 a month for the car. It's up to $1,000 a year. I wish it was $1,000 a month. Sorry about that. So if you used car repairs to get new tires and it costs $500, you still have $500 if your car breaks down later on that year and you need another repair. Right now, under COVID-19, there's a few TANF things to keep in mind that are really important. If you apply for TANF right now, you can do it over the phone and you can do your interview over the phone instead of in person. Usually you have to go to the department to do those. You can do them over the phone now. One thing to keep in mind is that if there are two parents in the households, the person on the phone from DHS will want to talk to both parents or will want something signed by the parent who wasn't part of that phone call, because when you apply for TANF in a two-parent household, you're both committing to do the participation, the Aspire work. And so both parents have to agree to be part of TANF. After you get on TANF, there's an orientation with another organization that runs the Aspire program. It's called FedCap. Right now, those orientations are happening on the phone or on the internet via Zoom. You are not required to go to DHS or FedCap or any other in-person thing during this time. So on the meeting that I was on earlier today, where I learned about a couple of other changes, I found out that this right now has been extended through the end of June. And so at least through the end of June, people will not have to leave their homes. While they should be sheltering in place, they will not have to leave their homes and go to in-person participation or meetings. The most important thing on this slide is this: DHS will not grant any sanctions during this time. And so if you are on TANF and you're struggling and FedCap is telling you have to do things, keep in mind that you cannot be sanctioned while COVID-19 is still a state of emergency. So if your worker says, if you don't do this Zoom meeting, we're gonna cut your TANF off, that's not gonna happen right now, okay? And also importantly, they won't be able to sanction you after this is over for anything you didn't do now. All right, one other really, really cool thing that's happening right now because of COVID is that people who already used all the TANF they're allowed to have, which is 60 months in a lifetime, people who are in that situation are going to be allowed to come back to TANF right now. So because of the state of emergency, it's considered an exemption to the TANF time limit, and so you can get that exemption to come back on. Chris, is there anything else that's like COVID-19 related we should say about TANF?
No, I think you've hit the most important ones.
Okay, great. We are going to talk a little bit about the Aspire program, and this is not stuff that's going to be super relevant to people right now, because right now you don't really have to do participation because of COVID-19, but I want people to be aware of these things in case they have to stay on TANF afterwards. So I'm going to kind of try to zoom through this really fast, but bear with me. So again, Aspire is that program where you have to do work or participation in order to stay on TANF. This slide tells you the rules about how many hours you have to do depending on your household, depending on how old your kids are and depending on how many parents are in the household. This slide shows some of the things that can be used to meet those hours: work, volunteering, on-the-job training, school. So college is one of the things that can be used to meet FEDCAP participation hours. Even when we're not under COVID-19, that will still continue. And we're going to talk about some programs that help people go to college. I'm thinking that there may be some people during this time that are feeling like if they went to school right now, they could change their vocation and they would be in more stable employment. And so we're definitely going to talk about some of the options to do that. So there are options to go to school and get a degree and to change, you know, to take a different pathway. So these are some of the things that count for participation. The non-core activities are things that you can count after you've already met your 20 hours of core activities. So you have to do 20 hours in that first column, and then you can do 10 more hours in the other column, or however many hours you have to meet, depending on your household size and your age of your children. So again, we're going to fly through these things. This slide is about good cause. Now, good cause is when you tell TANF that I can't do the thing you're asking me to do for this reason. Now, good cause may be that today my child was sick and so I can't come and do the thing, and it's just for today. Good cause could also be, you know, for the next 3 months I'm laid up because of a surgery, and so I need good cause to not have to do participation for an extended period of time. There are a number of reasons that can fall under good cause. Many of them are written in the rules. But sometimes if the reality is that you just can't do the thing they're asking you to do, you should contact us and we'll see if there's a way to request good cause for your participation. So I'm not going to go into this in much more detail either, but always remember, if you're on TANF and FEDCAP is asking you to do things that you just can't do, please contact us and we will do our best to help you get that fixed. Okay? All right. Parents as Scholars. Parents as Scholars is the program that I was kind of talking about, where people can go to school and get a degree and get assistance and support from the TANF program while they're doing it. I did Parents as Scholars. I got my undergraduate degree on that program. I had been a homeless single mom with 2 toddlers. It's a whole thing. You don't need my story right now, but I love this program. It's one of my favorite things. So what kind of help can you get from Parents as Scholars? Childcare, transportation, car repairs, all those things, same things that we talked about under regular TANF, you can get for Parents as Scholars, but some of them are a little bit easier to get under the program and some of them are a little bit expanded. You can also get eye care, which is glasses, or eye exams that aren't covered by MaineCare for whatever reason, and dental care necessary to alleviate pain or to help you become employed. That one can be harder to get from the department. You have to argue a little bit that you need it, but it's there and it's necessary for a lot of people, and we're definitely happy to help people argue for that. You can also get books and supplies. You can get some help for tuition. So if you got financial aid, but it wasn't quite enough to pay for your tuition, they will actually help you pay for the rest. You can get uniforms if they're required for your job, and then other like professional clothing if you don't have that already, and that's a need. Expenses like money to pay for an exam that you have to take to get licensed. So there's a lot of options here. A lot of times parents don't go to college because they know they're riding that thin line between being able to make it and not make it. And if their car breaks down, they're not going to make it, and everything they did for college will be a waste. Well, this program allows people to do that and not have to worry about those things and be able to stay in school and have those needs cared for. So it's really important. And if this is an option you've been considering, we'd love to talk to you more about it. This is some of the eligibility guidelines. We won't go into that too much today again, because it's just a lot of information, but again, happy to talk about it. The other thing we want to mention quickly, and I've mentioned it a couple times already, is FEDCAP. So FEDCAP is this third-party organization that has been hired by the Department of Health and Services to manage the Aspire program. So when you are in Aspire, you have to do participation, you have to report that to somebody. FedCap is who you report to, and they're the ones that help figure out what you have to do for your participation. Now, FedCap, pretty much since day one, we've been having issues with them really wanting to push people into doing things that didn't make sense for them, and to going back to work when they weren't necessarily ready, and just kind of a lot of issues with FedCap. So back in early 2019, we had a couple of meetings with the Department of Health and Human Services where we brought people who had been having issues with FedCap. And then the Department of Health and Human Services listened to the issues that we brought before them, and they wrote a letter to FedCap saying, like, you really need to get your act together. And then they hired a third party to come in and monitor FedCap and do an assessment, and to tell them the ways that they needed to improve things. So we have seen some improvement since then, but there's still a lot of issues with the program. And we really want to hear about issues people are having. And also we want to help people. So if you're having a problem with your FedCap worker and you can't get them to listen to you and you just can't make any headway, please call me, and we're going to help advocate for you and see if we can get things fixed in a way that works for you. Because this is a life program, right? If you're on TANF, you're on it every day. And you have to be able to do things that work for you, that make sense for you, and that actually lead you to a better future. So these are some of the issues that we saw and have been seeing with FedCap. A big one has been confidentiality. They seem to like to talk about people's cases in front of other people. They've been discouraging people from the Parents and Scholars program and from going to college in general. They don't grant people good cause when they have reasons why they shouldn't need to have to do a participation thing. They ask them to sign contracts that don't actually make sense for the person, and so on and so forth. Essentially, the big issue is we should be helping people do things that make sense for them and help them to achieve a goal for a better life and a better future, and that's not what's happening. So again, we want to hear about those issues and we want to help where we can. All right, so that is my whole TANF spiel. Does anybody have other TANF questions? And Chris, is there things that you think I should put out there as well?
I see a question, and it's a person that has a client that's both attending classes. I'm assuming that's at a post-secondary institution, and meets with FedCap. She meets with them twice a day for 3 hours a day. And we can't really tell if that's right without knowing more about whether, you know, how old her kids are, what her other activities are, but it sounds suspicious because it sounds like she may already be doing a lot of participation just with her classes. And I'm assuming she's asked to meet with them, being asked to meet with them on the phone. They're not allowed to ask people or require people to come into their office at this point in time. And as you'll recall, people cannot be sanctioned if they say, I just can't do that right now. They can't be sanctioned now, and they can't be sanctioned in the future for anything they said no to now. So it sounds like we need to know more about that client. And as Mariah has said, we'd be more than, we want to know about these issues because we've had an ongoing dialogue with the Department of Human Services about problems with FedCap, and we want them to understand whether they're continuing to act without regard to the law or asking people to do things that are unreasonable.
Absolutely. FedCap has a requirement to follow the rules of these programs as they're written in law. And so one of the best tools we have for, for helping people is to just say, like, look, this is what the law says. It says they have to do this, and you're asking them to do that, and it's not okay. So especially when it comes to education. So someone who's in school is allowed 1 hour for each credit and another hour for study time. And so if you're taking 12 credits, you're doing 24 hours of participation. If you're taking 15, you're already at 30. And so sometimes people are definitely asked to do more when they're in school, and that is not acceptable, especially because we want people to feel like they can do school and they're not being overwhelmed with other requirements. Were there any other questions?
Yeah, one last question. Someone's asked, are the dollars for car repair and Aspire in addition to the dollar amounts for car repairs and TANF? They are the same thing. And so there is one amount for car repairs, and that is the number that Mariah talked about earlier. And there aren't two different programs. Aspire car repairs are what you get if you're a TANF participant.
I apologize. I think I'm the reason for that confusion. So when I talked about parents as scholars, I also talked about car repairs. If you're doing parents as scholars, it is your Aspire participation. And so the help you get when you're doing parents as scholars is your Aspire assistance. So you get support to do those things from Aspire. All right, I think we're gonna move on. Where are we for time? Oh my gosh, okay. Real quick, I want to talk about another program that is also to support people who are looking for higher education. This is the HOPE program. It helps support people who are going to two-year programs, to welding, CNA. They call it a certificate of value. So if you're going through a program that will lead you to a certificate that will allow you to get a job, then HOPE is a program that may help you. It takes people at higher income levels than TANF, so you can have up to 185% of poverty, and you can ask me later what that is. And so people can get into this program at higher income levels. It does not provide you with monthly TANF money, so this is not TANF, but it helps with almost all the other things that the Aspire and Parents as Scholars program help with. So this is about who can enroll, and this is about what can you get in this program. So again, it pays for childcare, transportation, money for textbooks. HOPE right now during COVID-19 is actually paying for parents to still send their kids to childcare if they want to, even though they're doing school at home online. So HOPE understands that going to school online is still work and it still takes time and concentration. And so they're still actually providing childcare even though parents are at home right now. So it's a really great program, and they have a lot more flexibility to be able to help people. Also, when you do HOPE, you get assigned to a navigator who can help you if you run into some issues that would normally cause you to drop out of school. That navigator can help you figure out how to resolve them. So it's a really great program. And again, if people are thinking about making a career change during this time, it might be a good time to think about going to college and getting assistance through some of these programs.
And we have a wonderful HOPE navigator on the chat reminding people that you cannot get HOPE assistance from HOPE if you are getting TANF. If you're getting TANF, you'd look to Parents as Scholars. HOPE is for people whose incomes are above the TANF limits.
Absolutely. Yeah, thank you for that clarification. All right. We're going to talk about MaineCare. There's not a lot to talk about here. MaineCare is a health insurance program for people who are low income. It's Medicaid. It's the Maine's Medicaid program. And if you are in these categories and in these income levels, then you qualify for MaineCare. So I saw a lot of people did respond at the beginning that they are having a hard time with healthcare costs. If you have lost your job, it is really, really likely that you qualify for MaineCare. MaineCare does not have like open eligibility periods where you can only sign up during this time of the year. It's not like that. The day that you lose your job, you become income eligible because it's prospective. And so it looks forward to what your income is going to be. And your income is going to be nothing. And so you're eligible for MaineCare. Now, if you do have some income, you still may be eligible. For adults who are under 65. They're eligible. One person in the household is $1,468. If there's two people in the household, it's $1,983. If you have children, your children are eligible if you have income up to $2,265. Well, that makes no sense. There would never be a child with a one-person household. So if a child was with you and their parent, or with a parent and one child, it's for one child is $3,061. So this chart is just really helpful to look at to see whether or not you fall into a category where you qualify. But again, we're happy to talk to people about this program and answer questions if people aren't sure if they qualify for MaineCare. MaineCare covers most medical needs. It covers transportation to and from appointments. It covers case management. It covers your primary care and most diagnostic tests and medications. It's really a great program. If you don't have healthcare right now, I really highly recommend that you look into whether or not you qualify for MaineCare. One other really good thing to talk about right now, about MaineCare is that if you have MaineCare, you will not lose it while this state of emergency is going on. So while we're still in this crisis, you will be able to keep your MaineCare through the end of that. So right now, they've told us it's definitely through the end of June. And then after that, it'll be reassessed for the next month. But if you got MaineCare and then you started getting unemployment, and your unemployment, because of the extra $600, bumped you up to this place where you're normally wouldn't qualify for MaineCare, you're not going to lose this MaineCare while COVID-19 is still a state of emergency. Okay. And then one other thing, I actually had someone reach out to me. She's a person who helps people navigate getting paid or getting help paying for medications. And she said she wanted me to make sure I reminded everybody that if you can't pay for a medication, there are lots of programs out there that can help. So if you're not eligible for MaineCare and you need a medication and you can't afford it, talk to your doctor's office and they can usually refer you to somebody who does assist with those things. So that's for you, Martha. I don't know if you're here, but I remembered. All right. So if you want to apply for one of these programs, they are all through the Department of Health and Human Services. You can apply online at their website. It's My Maine Connection. You can apply by printing out an application and mailing it in. I don't have a thing for this on here, but you can apply right now on the phone for some programs and then do the entire thing over the phone. So for SNAP and for TANF, you can apply and give your voice signature over the phone and never actually have to fill out a paper application because of COVID-19. I have it X'd out here because this was the case at the time when I made these slides, but at this moment, you can go into the Department of Health and Human Services office in person and get assistance that way if you want to. What they're doing is they're setting people up in one interview room and then the worker will be in another interview room and they'll do it on the phone. But if you feel like you need to be there in person in order to do this, they are trying to do that in a safe and healthy way. And so they're doing it from 9 to 11 in the morning and then 1 to 3 in the afternoon at all the offices. So that's how that's working. And then in a couple of weeks, they're actually opening back up in the offices for full 9 to 5 hours. What they're going to do is they're going to put stickers on the floor saying stand here and try to keep people 6 feet apart. And they're putting some different things in place to help with that social distancing while you're at the office. I don't know if you've ever been to one of the offices. It's not a place where it would be easy to social distance, but they're working and doing their best to set that up. However, while this crisis continues, the best way to apply is going to be to do it by distance. So online, paper, over the phone. One of the best reasons to do it online or over the phone is that your benefit date starts the date that they receive your application. And so if you go online and you fill out that application, even if you're not sure about some answers, even if you're not sure if you have all the information they're going to want, you fill it out and you send it. They'll send you a letter telling you what else you need to provide them, but your benefit will go back to that start date when everything is all said and done, okay? So that's very important. It holds that date for you so that you don't lose out on benefits that you could be getting. All right. So we have another poll question here. Breen, can you put our poll question up? So I have been hearing from a lot of people that it's taking them a while after they've applied to get any response back from DHS. So it'd be really helpful for us to know right now, if you or someone you know has applied for TANF, SNAP, or MaineCare, or all of the above, please let us know how long it took to get a response. 4 weeks. Oh man.
While we're waiting, Mariah, a couple of questions. We have people who said, one person who said, I just got off the phone with DHHS and was told that what was not an option. I'm assuming they're applying by phone. I know that there are some programs where you still can't. Is that correct?
You can't apply for MaineCare by the phone, but you can apply for SNAP and TANF completely over the phone right now. And so you may have gotten a worker who is confused or misunderstood, but you should be able to call and do that whole application over the phone.
Oh, she said, sorry, it was not an option to go into the office, she was told.
Oh, she was told it was an option to go to the office. So I asked this morning, I asked the person who's the director of the Office of Family Independence to tell me like what it looks like when people walk in and try to see someone. I'm wondering if maybe he doesn't realize that there are places in the state that aren't open like that. I think it's possible that the Portland office is not doing that, which would kind of make sense because there's more community transmission in Portland. And I think in some of the far out counties, like I'm pretty sure in Aroostook County, they are open for those hours because they don't have as much concern there. But the information I was given by the director of OFI was that they're taking them in person, but I could be wrong.
Right.
He could be
And
wrong.
Kate Dodge has said you are allowed to drop off paperwork, but no appointments in Portland. So
Okay. Yeah, that's kind of what I was thinking was happening there.
Wow.
And as we all move forward in this, in this time, I think there's going to be some places that do kind of go back to more of a normal operating, and then there's going to be some places where it's just not possible to do that yet. So I'm looking at this poll, and it looks like 30% of people have waited at least 4 weeks for a response, and that's just not acceptable. We have people who haven't gotten a paycheck since the middle of March, and those people need help right now, not 4 weeks. So it's really, really valuable to know this information. And if you're still waiting and you still have not received a response, please get in touch with me when this is over, and we will do our best to get that figured out for you. Okay? All right. Thank you, Umbreen. Okay. I have to click on my screen again. There we go. I wanted to talk a little bit about stimulus payments. I think probably most people know by now that the federal government decided to send an economic impact payment to everybody in the United States. For people who filed a 2018 or 2019 tax return, that should have already come automatically in the same way that their return came to them. So if they had direct deposit set up for their return, they should have already received that. And I believe those checks already went out for people who needed it by check. For people who get SSI and SDI, or railroad retirement, which is an interesting thing, those people will also get those automatically without having to file their taxes and not having to go online and sign up for anything. However, if they have dependents, they will not get the extra $500 for each dependent. There was a date that was a deadline that the IRS put into place for people to have to go on and file for that. And then unfortunately that deadline has passed. So there has been some talk from advocates about trying to extend the deadline. And so there's no reason why you shouldn't go on and do it anyway at this point, even though that deadline has passed, but there's no guarantee that you'll get that $500 this year. However, you will get it next year if you file a 2020 tax return in 2021. The money from the stimulus payment will not impact any of your benefits for 12 months. If somehow you still have that cash after 12 months, it'll be looked at as an asset. I can't imagine that most people will have that money 12 months from now, but it will be looked at as an asset at that point. If you don't need to file the tax return and you're not in one of those categories where you get SSI or SSDI, you can go online to that tool and you can still file for them to send you a payment, and that should still come this year. And then if you do have earnings where if filing a tax return would help you get some additional funds as well, like earned income tax credit, you can go and ask for help from Cash Maine. It's a coalition that helps people, low-income people, file their taxes and do other financial advising. Is there anything I'm missing in that one, Chris?
No, the only thing I'd add is general assistance is one of the programs that cannot count these stimulus payments. And we've seen a lot of cases where that's not been entirely clear to the local municipality that runs these programs. So just know it cannot be counted by the general assistance program.
If you file for general assistance and they tell you that you have to use your income, your stimulus payment first to pay for your rent or whatever, that's not the case. They should be ignoring that and pretending that doesn't exist. All right, speaking of general assistance, we're going to quickly talk about that program. This is a program that's probably going to be most helpful for people who do not have children in their home and don't qualify for TANF and are still waiting for unemployment or have other needs for various reasons. General assistance covers your basic needs. And when I say basic, it is really basic. They can help you with rent, utilities, transportation to and from a job, or I believe to and from medical appointments. They can give you vouchers for food, and they can pay for medicine or necessary medical treatments. But they're going to have to, you have to get a doctor to like write you a letter saying why this is medically necessary. That it would be in danger to your health to not have it. And so one of the problems we see with general assistance is that people are paying their other bills and then going to general assistance and saying, I can't pay my rent. And general assistance says, well, we don't care that you have a car payment. You're not allowed to pay that if you're poor. And so we're going to take that out of the amount that we would give you for your rent. So really it is very basic needs. You're eligible if you live in that. Okay, hold on a second. I just realized that I didn't explain one thing about general assistance. Yep. So general assistance comes from your town. It comes through your municipality. The town pays for part of it and the state pays for part of it as well. So it's also managed by the Department of Health and Human Services, in that if the town is not managing it correctly, the department can help you. So you're eligible for general assistance if you live in that town, or if you're homeless, you can apply in the town that you are standing in at this moment in time. Or if you plan to move to that town, like you have to leave where you are, or you're homeless and you want to move into this town, that town can help you with general assistance for your security deposit and rent. So you have to be there, and you have to not have enough money to meet your basic needs, and you have to not have any other assets other than a home or a car. Pretty much all assets count for general assistance. They are really, really strict. You apply at your town hall or your town office. Right now, most town halls, aren't being staffed in person. And so when you call, they should have a number that tells you who you call and how you apply for general assistance. If they don't have a number and you can't figure out who to talk to apply, you can call the Department of Health and Human Services hotline. And I have that number on the slide. Everyone has a legal right to apply for general assistance. One thing we see really common with general assistance is that you call your town, you tell them some information, and they say, oh, you don't qualify, and they don't let you actually apply. You never get to fill out an application. That is not correct. You have to be able to apply. And then if you're denied, they have to give you a decision in writing, and then you have 5 days to appeal that decision. If you need help with the general assistance appeal, Pine Tree Legal does those and does a lot of them, and is the resource to turn to. If you can't go to Pine Tree Legal because your citizenship means that they can't help you, Maine Equal Justice will help you at that point. If there's a child in the household who's a citizen, then Pine Tree Legal can help that household. But if no one is a citizen, then Pine Tree Legal probably won't be able to help, and you need to turn to us, and we'll help you with that at that point. But remember, you're allowed to apply, and they have to give you a decision in writing, okay? And then you have 5 days to appeal that decision. If you are in need and you can't pay your bills right now, apply for general assistance. Your first application, they're not supposed to be able to look back and say, oh, you paid your car payment and your internet, so we're not going to help you. But if you need help again the next month, then they can look at those things, and they'll take that money out of what they're giving you. General assistance is super confusing to me. It's not my favorite thing to explain. So Chris, if I missed anything or if I messed up, go ahead and chime in. Oh, you're muted.
You're muted.
We're close to time, but you did mention that if people cannot get help from their town, they should call the DHHS hotline and ask them. DHHS has responsibility to help people within 24 hours if they haven't gotten the help they need from the town and they're eligible. Call us if you have any problem with that.
So the number is right here on this slide. And again, everybody's going to get a copy of these slides. And yes, the department should be helping. And I've seen them actually help a few people already during this crisis. So it's been working.
Great.
All right. So we have a poll question. Have you or someone you known applied for general assistance? And if you have, were you approved or denied?
We're seeing a lot of questions, people saying they're seeing a lot of problems with general assistance. We would like to see those problems or hear about them. We have a staff person who's really looking at general assistance issues. And so if you, Mariah, what's your suggestion as to what's the best way for people to sort of get in touch with us if they want to talk to someone, talk to Deb about general assistance?
Yeah, so they could definitely, I don't have Deb's email in here. So but my email address and my phone number are in here. You can go ahead and email me and I'll pass that on to Deb, and she'll do her best to connect with you to like collect that story. It looks like some people on this call applied and were approved, which is awesome. So that's great. It's a great program when it works, but some of the towns don't use it correctly. All right.
And someone's asking on general assistance, how many times can you apply and how long can you get it? The bottom line is, as long as you are eligible, you can get general assistance. There isn't a time limit on general assistance. Sometimes I tell you that, but that's not the case. Go ahead and apply if you think you're eligible.
You will have to reapply every month though. It is a
right.
month-to-month benefit, and you will have to apply again the next month and have to show that you're eligible the next month. So again, the first time you apply, they won't necessarily ask you what you spent all your money on this month, but the next month, if you have to get it again, you will have to tell them everything you spent money on. And if you spent money on something that they don't consider to be essential, they'll take that out of what you're eligible for. All right, let me see, let's move on. Just have a little bit left here.
So we are at time. I think that Mariah, we all can stay on for a little bit. I understand that not all participants are going to be able to do that, but we will continue on and we will distribute this webinar to you so you can watch the end of it.
All right, I am so sorry to time. I knew we were going to cut it pretty close, but I appreciate anybody staying with us if they can. So we're going to talk real quick about immigrants and access to safety net programs. So access for immigrants depends on what their immigrant status is. So if you're a refugee, you have access to pretty much all safety net programs. If you have been granted asylum and you're an asylee, then you have access to pretty much all the programs. If you're an asylum seeker, which means that you're someone who's applied for asylum but has not been granted asylum yet, but you have an application in, then you can get TANF and SNAP if you meet a hardship exemption, which means you're elderly disabled, you're a victim of domestic violence, you're waiting for your work authorization, or you're unemployed. So unemployed is the one that applies to most people. It used to be that unemployed was not a hardship exemption for TANF and SNAP. And that once you got your first job here under your work authorization, then you weren't eligible anymore. But now if you lose that job and you have to go back, you can come back onto TANF and SNAP. For MaineCare, if you're an asylum seeker, you get full MaineCare if you're pregnant or if you're under the age of 21. Everybody else is eligible for emergency MaineCare. And emergency MaineCare covers everybody regardless of immigration status. And so if someone is undocumented and they need health care and it's an emergency, they can get it covered by emergency MaineCare. It's good to apply in advance so that you already have it, but the hospital will probably help you apply afterwards if you have an emergency situation where you needed to go to the ER. It's very limited. It is really just for that distinct emergency and not for aftercare. It's not for ongoing care. It's pretty straightforward for emergencies. Chris, did you want to add something?
Nope, you've got it.
Sorry, I thought I saw you unmute and I was like, oh.
Nope.
One thing that we get asked a lot is it safe for people who are undocumented to apply for emergency MaineCare? And the answer is yes. The Department of Health and Human Services does not share that information with any other government agency. And so even if someone is undocumented, we have not seen any issues with them applying for emergency MaineCare. General assistance is another program that is eligible to some statuses. It's eligible, people who are refugees are eligible, people who are asylees are eligible. Those statuses are pretty much good. But for people who are asylum seekers, it can be a little bit more complicated. You are eligible for GA now if you have sent an application or are planning to apply and trying to get the stuff together. So the distinction on this slide is you don't have to have an actual application submitted yet. You have to be working on it though, in order to apply for general assistance. Anything you want to clarify there, Chris?
Nope, you got it.
All right. And then we wanted to just talk about how does unemployment impact other benefits. So a lot of people have been applying for unemployment. A lot of people are getting it now, fortunately, not everybody, but if you get on other benefits first, and then you want to know whether or not unemployment is going to be problematic. So for your base unemployment, like the unemployment that's based on your earnings, it counts as income for all of these programs. But the extra $600 a week doesn't count as income for MaineCare, and it doesn't count as income for housing, but it does count as income for TANF and SNAP and other programs, other needs-based programs. Now, nothing you get from these needs-based programs affects your unemployment. So if you are still eligible for TANF or SSI after you get unemployment, you don't have to report those because unemployment is not needs-based, it's based on your earnings. But the other way around, once you get unemployment, you do have to report that information to the Department of Health and Human Services, and it likely will put you off of TANF and SNAP. With this extra $600 a week, almost all households are going to be over income for TANF and SNAP once they start getting that. But those are good programs to help people get by in the meantime. Sue, Chris, anything else you want to add in there?
Nope, just to note that the extra $600 is scheduled to end on the week ending July 25th. So, you know, after that, things may change for eligibility in these programs.
Absolutely, and you should reach back out to the Department of Health and Human Services at that point, especially if you were getting food stamps and your food stamps closed, you may be eligible again after that. All right, and then this is an unemployment question. We just kind of want to keep hearing from people. How long they're waiting for unemployment. So if you've applied for unemployment, or if you know someone who's applied, how long have they waited for benefits? Oh, a bunch of people got it right away. That's good. Oh, now it's interesting watching the poll, the numbers go back and forth. Oh, 1 week or 5 weeks. It's like two ends of the spectrum. If you didn't get it right away, you're going to have to wait forever. Wow. All right. Some people have been waiting more than 7 weeks. We really, really appreciate this information. Okay. So, did you want to say anything about that, Sue?
I'm sadly not surprised by those results, although that's a lot of people who've been waiting a long time for benefits. And I will say that the department had been really trying to push out uncomplicated claims quickly. That has changed this week, and it's going to take longer. What I want to say is that we're trying to provide assistance, but for a lot of people, what they need is for somebody who works at unemployment to look at the back end of that claim and make sense of it. And unfortunately, we are not able to do that. but we do want to hear from people who have been waiting a long time for unemployment. Chris, did you want to add anything?
No, I was just going to say the same thing. If you've been waiting 6 or 7 weeks, I know anything is an eternity right now, but if you've been waiting 6 or 7 weeks, why don't you give us a call and we'll try to get your name to the Department of Labor and ask them to take a look at it. You can imagine how hard it is to get them to pay attention to anything right now, but we'll take a shot at it because it's totally unacceptable. And they're just underwater themselves. I'm sure everybody understands that situation, but it doesn't help if you're waiting and you badly need those benefits. So let's see if we can unstick some of those.
And the last thing that I would say about that is that these other benefit programs are able to fill some gaps, not everything, but some gaps during that period of time.
And know if you've been waiting a long period of time, you will, and you become eligible, you're found eligible, you will get those back weeks of benefits at some point. And those back weeks will not count as an asset that makes you ineligible for SNAP.
Yep. All right. I'm not going to stop on this one. We're going to go forward a little bit, and I'm going to ask Breen to talk for just a few minutes, and then we'll go back and open up for questions.
Great, perfect. So I first want to just express all of my gratitude to all of you for taking the time to be on this webinar and being with us a little bit later than expected. And I want to share with you that we cannot do this work alone. Your involvement helps us ensure that all Mainers have food in the fridge, a place to call home, and healthcare that they both need and deserve. You know, at Maine Equal Justice, we work in partnership with the people that are impacted by the policies, and those are the folks that are advocating for change with us so that we can improve public policies together. We build power together, and together we're able to have an impact on policy decisions that change lives. So I want to share with you, I'll post the link in the chat, the Take Action for Maine Equal Justice. So we'd love for you to sign up for updates by joining our email list. And if you're someone that is impacted by poverty, someone that is impacted by these policies, I'd love for you to reach out to me. My email is arana@mejp.org. I can type that in the chat if you are someone that would like to get involved with advocacy with us. And Mariah, you can go to the next slide.
Oops, sorry.
No, that's great. And we just want to also share with you a couple of resources and some contact information. So of course, a lot of you may know that we have this COVID-19 resource page on our website. So you'll see the link there. We'll post it in the chat. So that, you know, it's full of fact sheets and information on anything from childcare to food security, to unemployment, to resources for immigrants. We've just created this landing page for all of the information that you might need when it comes to resources on COVID-19. So check that out. And we're updating this daily, actually, because we're getting new information every single day. And of course, follow us on Facebook for updates. We're posting new content every single day. Lots of information is coming in, and we'll be sure to share that with you. So follow us on Facebook for that. And of course, Mariah is going to share her contact information, and Sue is as well. But if you want to use our online form, if you have a legal problem that you need help with, you can navigate to our website, go to the people section, and just fill out the online form, which is our legal assistance contact if you need any help.
Thank you, Anne-Breen. We really can't do this work without all of you. It's really super important. And we wouldn't want to do this work without you, because we wouldn't want to try to make policy decisions for people in poverty without talking to people in poverty. So it's really, really important for you guys to be part of this. And we appreciate the effort that you all put into it. All right, so we are opening up for questions. Anne-Breen, is there a way to open it up so people can say things, or should we just stick with chat now?
I believe we have to unmute people individually. So if folks want to raise their hand electronically, I can go through and unmute you. But to start, let's do it through chat.
So Mariah, there are a lot of questions about whether the MaineCare application can be done entirely over the phone? I believe the answer is no, but you were talking about this morning.
The answer is no. You cannot do the MaineCare application over the phone. The federal government is in charge of allowing those things or not allowing those things, and they have not gotten permission for the MaineCare app, just SNAP and TANF. So if you have to apply for MaineCare, what you can do is call in and have them take your application over the phone. They will mail it to you to be signed, and then you can mail it back. So that is one way to do it if phone is best for you. What you can also do is call me and I'll help you do it, and I'll mail it to you, and then I'll mail it to the department. So there are options there if you don't have access to the internet and you want to try to get it done as soon as possible. But if you call the department and do it on the phone with them and they mail you that application, I believe that your start date starts the day you talk to them. One other thing to talk about with MaineCare is that it can go back 3 months if you were eligible financially during those months. So if you didn't apply until May, but you lost your job in March, they'll backdate it and they'll pay those medical bills that have come up since then. And if you've paid for medication since then, you can go to your pharmacy and get reimbursed. So that can be really helpful for people who just didn't know that was an option for them.
I'm going to actually ask a question myself. I've been busily answering questions all through this. But I wonder if we had a lot of people on this call. A lot of people have stayed over, which is very gratifying, and I'm very happy about that. I would love to hear in the chat from you what other subjects you would like us to cover in more depth in this format, because we've been feeling like it's been pretty successful. So please flood the chat with suggestions for things that you want to, topics that you would like to see us cover by webinar.
Awesome. That's a really, really great idea. Yeah. What should we do next?
There's another question from Humam saying, since the extra $600 in unemployment insurance will end on July 25th, will DHHS just resume TANF and SNAP? And the answer is no. You're going to have to call them, tell them that you've lost that income from unemployment insurance, and ask them to reinstate or reapply for both TANF and SNAP. I'm sorry that that has to be the answer. We tried to persuade them to just suspend those benefits so you wouldn't have to reapply, but they were unwilling to do that.
Yes, you will probably have to resubmit the whole application, even though they have all that information already, which is super frustrating and annoying. But if they close your benefits, you have to reapply to reopen them.
Someone's asking about Department of Labor and getting them to process your claim, or will they automatically get to the claim at some point? I think that if an unemployment claim has been stuck in processing in one way or another, there are a lot of groups of people who had specific problems who've already been pushed through. If you have a claim that continues to be stuck, the best advice, and I can't tell you how much I hate saying this, is to call and call and call until you get somebody. I will say that it's hard still to get through. And even after you get through to an individual, you'll probably have to wait for a significant amount of time to talk to an individual who can actually really look at your claim. If you've been stuck for 6 or 7 weeks, please contact us directly. And for anyone who's doing a new claim, who maybe have been out of work for a period of time and just realize that maybe they can be eligible for unemployment, they're going to have to talk to a representative at the Department of Labor to claim the weeks from the time they got laid off to the time they opened their claim. There's no easy way to do that at this point without calling. You have to call and talk to a representative to get that eligibility in place. So I wish I had a better answer to that question. Kate says, Mariah, you had mentioned additional benefits from parents as scholars. My question is, who would I talk to help clients enroll in the additional eye care and dental care coverage, DHHS or FedCap?
So you have to talk to FedCap, and you have to convince FedCap that it is a need that is required for you to be able to continue to go to school or to be able to go to work. So, you know, I can't drive my car anymore because my glasses broke and I have to drive my car to get to school. So it shouldn't be too difficult to get the eye care one. That one's pretty straightforward. But the dental is a little bit more complicated. It's to, like I said, to resolve pain, or it's to fix something that's going to keep you from getting into employment. So if you have some like pretty obvious and visual issues with your teeth, there's up to $2,000 to be able to fix that. When I was on TANF and in Parents as Scholars, they told me that the Department of Health and Human Services told me, the FedCap wasn't even involved at the time, that they can't do that until you're almost ready to graduate. And that's not really the case. So we're happy to go to bat for people about that, but it is through FedCap. And what FedCap does is they collect all the documentation necessary, and then they submit it to DHHS, and DHHS has the final approval or denial on that. And so if someone's request has been submitted and they've been denied, we can help appeal that. If you talk to FedCap and they just didn't submit anything, I would like to know about that, and we can help you, you know, get that actually submitted so you can get a decision. With all of these things, you should be getting decisions in writing, and so if you're denied something, you should have it in writing. FedCap is pretty bad about that. They just talk and don't actually put anything down on paper, so then there's nothing to appeal or to go to bat about. And so if you're case manager and you're advising clients, advise them to request everything in writing. I want to see a decision on that in writing. Thank you. And just be firm about it.
The only other thing I'd say about dental is the MaineCare. If you're receiving MaineCare, or if the person you're working with is getting MaineCare, there is a limited MaineCare dental benefit for the purposes of relieving pain, infection, or preventing imminent tooth loss. And so if you're in that situation, talk to your dentist if you have one, or try to find a dentist that will see you. If you're having incredible difficulty finding someone or getting your dentist to do that, give us a call and we can try to help you navigate that problem, or get MaineCare services to do that.
Yep. Oh, I see a question here. Does the cash program work with asylees? I actually don't know. Chris, do you know?
I said I thought yes, but wasn't 100% sure about that.
I don't know that.
We will have to get back to you on that one. If you think about it, if you remember, send me an email, or we will try to respond to you. But there's so many questions we may not remember. So,
Chris, we have someone who'd like another session on when is it okay to say no to a boss because of safety concerns. This is something that we're actively talking about and creating written client ed about, but it certainly seems like something that we might talk about in another unemployment sort of ongoing issues with unemployment insurance and employment safety issues.
Yeah, I mean, we can give you a quick answer to that question by telling you should look at the pandemic unemployment assistance Q&A on our website. What we say there is, if your employer is asking you to work in a workplace that is unsafe, meaning that it doesn't meet CDC requirements or some other government agency's requirements for safety in the time of COVID-19, and you tell your employer that you'd like that he or she has to fix that problem, or you're not going to be able to work there, and you as a result have to quit or you're fired, we think you have a decent claim, a decent chance of getting unemployment insurance. We would like to talk to you, because those situations are always risky and they're very fact-based. We really need to help talk through the facts of your case and make sure you've taken every step you can to protect yourself. We're writing something right now that we're going to post in the next couple of days that gives you some tips about what to do to protect yourself, but we're also happy to talk to you about it. Right, Sue?
That's right.
All right. Well, I'm happy to stay here for a little bit longer if there's more questions, but it seems like they're dying down. That what you're
We have a bunch of people interested in logisticare and transportation issues. These are sort of suggestions for other things that people would like to talk about. That is helpful.
We're also looking into, and probably will soon, do a webinar on MaineCare, on SNAP, and on TANF, like distinct webinars, especially for case managers. And then those webinars can be recorded and live on our website where people could just go to them and watch them if they were new. And so that is something we're looking into. If organizations that have case managers are interested in that, please reach out to me. I'm also the training coordinator at Maine Equal Justice, and I'm the one who sets up trainings. And I'm also happy to just zoom in and do a in-depth training with case managers if there's an organization that thinks that would be useful. This is a lot of stuff we didn't cover here today because you can only do so much in an hour. All right. I think we're going to call it.
Okay.
Okay, thank you, everyone.
So much.
Thank you.
For all the work that you are doing out in the community. Those of you who are working with other people, I know there are a lot of case managers and other kinds of helpers on this call. So thank you so much for all you do.
And if you have any feedback on how we can make these webinars better or things that you like, definitely email us because we want to make this as accessible as possible. So we look forward to hearing from you.
Mm-hmm. All right.
Thanks, everyone.